Hello everyone and welcome. I'm excited to have you here today. We're about to dive into an important topic, Prometric Exam Preparation. The title of our presentation is Prometric 2025, One Question You Must Know. Over the next few slides, we'll be exploring key strategies and insights to help you succeed. We'll cover what you need to focus on to be fully prepared for the exam. So let's get started and make this a productive session. Let's take a closer look at the best method to confirm NG tube placement, which is crucial for patient safety. On this slide, we see a multiple-choice question with an explanation to help clarify the key points. The most reliable way to confirm that an NG tube is correctly placed is through radiographic imaging, specifically a chest X-ray. While other methods, like checking pH or observing the tube's appearance, can provide some clues, they are not definitive. It's important to remember that relying solely on clinical signs can be risky because misplacement can lead to serious complications. Therefore, using a chest X-ray as the gold standard ensures accuracy before administering any feeds or medications. This step aligns with our overall goal of safe and effective patient care. Always prioritize confirmatory imaging when in doubt, and understand that this is the most dependable method to prevent potential harm. Now, let's discuss the best method to confirm NG tube placement. Among the options listed, air insufflation, auscultation, X-ray, and aspiration. The most accurate and reliable method is X-ray. While air insufflation involves listening for a whooshing sound or feeling bubbles, it's not always definitive. Auscultation, or listening over the stomach after injecting air, can sometimes be misleading because sounds can be transmitted from other areas. Aspiration, which involves trying to withdraw gastric contents, can be helpful but isn't always conclusive either. The gold standard by far, and the most dependable, is an X-ray. It provides a clear visualization of the tube's position, ensuring it's correctly placed in the stomach before proceeding. This step is crucial to prevent complications, making X-ray the preferred method in clinical practice. So remember, when confirming NG tube placement, an X-ray is your best choice for safety and accuracy. Certainly, here is the word-by-word narrative script for slide 4. Let's focus on the X-ray, which is considered the gold standard method for verifying NG tube placement. This means it is the most reliable way to confirm exactly where the tube is. When we use an X-ray, we can see precisely if the tube has reached the stomach, which is our goal, or if it has inadvertently gone into the lungs, which can be dangerous. This step is especially important in situations where patient safety is critical, such as in patients with complex anatomy or when there's uncertainty about placement. Remember, the key point here is that an X-ray provides definitive confirmation, helping us prevent complications and ensuring proper nutrition and medication delivery. Let's discuss why other methods are not as reliable for confirming gastric placement. First, air insufflation. While it might seem straightforward, it's actually not recommended because it can be quite inaccurate. The amount of air you hear doesn't always correspond to correct placement, which can lead to errors. Next, auscultation, listening for air sounds, can be misleading. Sometimes, the sounds we hear can mimic gastric placement, but they don't guarantee that the tube is correctly positioned. It's a false reassurance that we need to be cautious about. Then there's aspiration and pH testing. While checking the pH of aspirated fluid can be helpful, it's not always reliable. Factors like medications, feeding, or the patient's condition can affect the pH, making it an uncertain method at times. So, considering all these points, X-ray remains the safest and most accurate method. It provides a definitive visualization of the tube's position, minimizing the risk of misplacement. That's why, in our overall approach to patient safety, X-ray is the gold standard for confirming gastric tube placement.